Hi, my name is Victoria Gorom, and I worked on the CDU med-surg floor at South Point Hospital this summer with my mentor, Joyce Lee. My project of my title is Improvements for Post-Op Respiratory Care. Post-op complications are the largest reason for post-op mortality. Certain patients are more at risk for these complications than others. The complications include atelectasis, pneumonia, respiratory failure, and exacerbation of COPD and asthma. Patients with the following factors are more likely to develop post-op complications. If a patient is over 65, their cells are less able to produce antibodies needed to fight infection. If a patient has an abdominal surgery, their incision makes it harder for them to deep breathe and cough and more painful, so they're at more risk to develop respiratory complications. The longer a patient is under anesthesia, the more depressed their lungs become, making them more at risk. And if the patient doesn't have a healthy diet, they're prone to infection. Atelectasis is the #1 avoidable respiratory complication after surgery. It occurs when the tiny air sacs in the lung, called the alveoli, collapse. The alveoli are like grapes. When atelectasis occurs, the grapes shrivel into raisins and lose their function. The way atelectasis is prevented is through the use of the incentive spirometer. Another complication is pneumonia. Pneumonia occurs when pathogens travel inside the body and cause infection. The infection leads to the inflammation of the patient's lungs. This is common in nursing home patients because pressure ulcers provide an area that allows bacteria to enter the body, causing an infection. Respiratory failure is a condition in which too little oxygen passes from the lungs to the blood. An incentive spirometer is used after surgery to increase the lung capacity of patients. They prevent many respiratory complications. Patients start using their spirometer in a sitting position. They completely exhale and empty their lungs. Next, they seal their lips around the edge of the mouthpiece. They have to breathe in deeply and hold their breath for at least 5 seconds. This action opens up their lungs and inflates their alveoli. They look at the yellow indicators to see the amount of air their lungs took in. Once they have completed this exercise, they are encouraged to cough and deep breathe, which removes the loose mucus from their lungs. If a patient has an abdominal incision, the nurse must split their incision with a pillow to prevent organ protrusion. The staff member encourages the patient to use the spirometer 10 times each hour while awake. The purpose of my study was to determine whether the nursing staff on the 7th floor is knowledgeable in the use and importance of incentive spirometry in order to accurately teach their patients. Nursing staff includes RNs, LPNs, and PCNAs. The results will identify knowledge deficits and educational opportunities for nursing staff. This is my abstract. A pretest will identify areas of weakness in the staff's understanding of incentive spirometry, and I predicted after I educated the staff that their post-test will reflect improved scores. The improved scores will indicate increased knowledge by the nursing staff, and they will be better able to teach their patients, thus preventing lots of pulmonary complications. First, I distributed a quiz to 10 bedside nursing staff on my floor. The purpose of the quiz was to test how well the staff understood the procedure for the use and the reason for the use of the incentive spirometer. Next, I developed an educational tool and reviewed it with the staff. After the review of the educational tool, staff took a post-quiz to see if their scores improved. Then I compared the scores of both quizzes to see an improvement. And this is what was on my quiz. Question number 1 said, a post-op patient should use an incentive spirometer 10 times each hour while awake. The type of surgery with the highest risk of post-op complications is abdominal. The #1 avoidable respiratory complication that incentive spirometers help patients to avoid is atelectasis. The important quantities that spirometers measure are airflow and air volume. The position that the patient should be in to use the incentive spirometer is a sitting position. After using the incentive spirometer, the patient should cough. And the longer a patient is under anesthesia, the higher their risk of complications, and that's true. So this is what I found after they took the pre-quiz. And as you can see, number 3 was the highest one missed. And that was because most of the nursing staff thought pneumonia was the #1 complication that spirometers help patients to avoid, but it's not, it's atelectasis. And the second highest number missed was number 2, and that's because most nurses said that chest surgeries were had the highest risk of complications, but it's actually abdominal surgeries. Half of the nurses answered 5 questions correctly out of 7, and 10% of the nurses answered all questions correctly. After the review of the educational tool, this is what happens after I requizzed the nurses. As you can see, only 10% of nurses missed questions 4 and 5, and 80% of the nurses quizzed received a perfect score. So in conclusion, the number of incorrect answers decreased after the nursing staff was educated on incentive spirometry. This indicates that a knowledge deficit did exist. Increased knowledge by the staff will result in more accurate education for patients, and the newly educated staff will feel more confident educating their patients and continuing to educate colleagues to ensure correct use of incentive spirometers. I recommend that patient education handout on the proper use of incentive spirometers should be given to patients at discharge to ensure continued proper use outside of the hospital settings. Teaching the use of incentive spirometry needs to be added to the nursing education curriculum for care of post-op patients, and the periodic review of the proper use and importance of incentive spirometers by staff on surgical units to prevent knowledge deficit should occur. All nursing staff should be involved in this review because all of them will be at the bedside working with their patients. I would like to thank Joyce Lee, Regina Fort, Linda Pasick, Carol Weber, Dot Rogel, and the Lakeland Respiratory Therapy students, the entire 7th floor staff, and the Office of Civic Education Initiatives. Thank you.